Is your whole body suffering from numbness, throbbing, or stabbing to the extent that even walking becomes a chore? If so, this pain you are feeling is known as neuropathy pain, which is nerve pain as a result of a lack of blood flow to the heart. This can create discomfort and pressure in certain parts of the body, making everyday movements like standing, balancing, or picking up a spoon nearly impossible. But don't worry, you are not alone. Nerve pain is very common in most chemotherapy and diabetic patients, as well as individuals suffering from a broken ankle or foot. Neuropathy, which is sometimes referred to as peripheral neuropathy, is not a single health condition, but rather a term used to describe a range of health problems involving damage to the peripheral nerves as well as the symptoms of those issues. While the group of conditions is irreversible, you can take steps to help prevent neuropathy or manage it through diet, lifestyle, and treatment. Peripheral neuropathy can affect anyone, regardless of age, sex, race or ethnicity, personal circumstances, medical history, etc. Peripheral neuropathy is also very common with some age-related diseases. That means the risk of developing peripheral neuropathy increases as you get older. How peripheral neuropathy develops, particularly the timeline of its progress, depends very much on what causes it. Injuries can cause it to develop instantaneously or within minutes or hours. Some toxic and inflammation-based forms of peripheral neuropathy may develop rapidly over days or weeks, while most other conditions take months, years, or even decades to develop. Diabetic peripheral neuropathy. The most common form of neuropathy is diabetic peripheral neuropathy, which affects between 12 and 50% of people with diabetes. Its symptoms involve a progressive change in sensation, as well as pain and weakness in the feet, and less commonly the hands. As the neuropathy progresses, it can lead to a loss of sensation in the affected areas. This lack of feeling increases the likelihood of injury to the affected areas. Without the pain to signal where there's a problem, people with diabetic neuropathy can allow small abrasions or blisters on their feet, for example, to fester as sores or ulcers. The ulcers can become infected because there are open wounds, which can also progress into bone infection. Unfortunately, commonly it requires amputations if it does progress to that point. Inflammation-related neuropathy. Inflammation caused by infections, such as herpes zoster, also known as shingles, Lyme disease, or hepatitis B and hepatitis C, can lead to neuropathy, as can inflammation resulting from autoimmune disorders, such as vasculitis, sarcoidosis, or celiac disease. In such cases, the symptoms tend to be burning, tingling, or numbness. Difference between neuropathy and sciatica. If you start to feel numbness or tingling in one of your extremities, you might attribute it to a temporary lack of circulation or your foot falling asleep. Usually, that uncomfortable pins and needles feeling goes away after a while. But what do you do if it stays for longer than a week? Prolonged numbness or tingling can be a sign of a more extensive problem. But how do you know for sure? Neuropathy and sciatica are two common nerve disorders that can cause discomfort and pain, and it is essential to distinguish between the two so you can get the help and medical advice that you need. The symptoms of sciatica or peripheral neuropathy are easy to confuse. Both conditions cause pain, numbness, and tingling in the legs and feet. The impact of your strength and balance may also make falls more likely. The key is not to confuse sciatica with peripheral neuropathy. The most important difference between the two is that peripheral neuropathy is static, while sciatica's symptoms can flare up or dissipate depending on certain levels of physical activity. If your symptoms worsen when you rise from bed in the morning, sit down, bend over, roll over, or even cough, then you likely have sciatica rather than peripheral neuropathy. Signs and symptoms of peripheral neuropathy. Every nerve in the peripheral system has a specific job. Symptoms depend on the type of nerves affected. Nerves are divided into sensory nerves that receive sensation, such as temperature, pain, vibration, or touch from the skin. Motor nerves that control muscle movement. Autonomic nerves that control functions such as blood pressure, sweating, heart rate, digestion, and bladder function. Let's take a moment to look at some of the more common signs to neuropathy pain. Ask yourself, Do I have one or all of these pain symptoms? 1. Temporary or permanent numbness. This happens when nerves can't send or relay sensory signals, causing the loss of specific types of sensations. An example of this would be picking up a cold pot pan, but not feeling the smoothness or coldness of the can, or not being able to feel the texture of carpet or the temperature of the floor through your feet. 2. Tingling. This happens when there's a problem with nerves that carry signals to your brain. This is like radio static you hear when you are too far from the broadcasting station. 3. Pain. Nerve damage from peripheral neuropathy can cause malfunctions in how and when nerves send pain signals, making pain signals more intense, hyperalgesia, or happen too easy, allodynia. It can even cause nerves to generate pain signals spontaneously. This is known as neuropathic pain, and it's the most noticeable and disruptive symptom of peripheral neuropathy. 4. Muscle weakness and paralysis. Nerve deterioration from peripheral neuropathy weakens the connected muscles. That can cause paralysis, which may cause difficulty moving the toes, foot drop, and hand weakness. Weakness can also affect muscles in the thighs, arms, and elsewhere. 5. Blood pressure changes. Your body automatically manages blood pressure, but damage to the peripheral nerves can disrupt it. This can cause sudden drops in blood pressure or increase the heart rate, especially when you stand up. 6. Sweating too much or not enough. Your body automatically manages its internal temperature, using sweating to shed heat. Peripheral nerve damage can cause you to sweat too much or not enough. This can lead to dryness or scaling on your feet, or excessive sweating after eating. 7. Bowel and bladder problems. Autonomic signals control your bowel and bladder without you having to think about them. Nerve fiber disruption can affect bowel movements, constipation or diarrhea, and can occasionally affect bladder control too. 8. Sexual dysfunction. Your autonomic nervous system controls sexual arousal. That's why autonomic problems can cause sexual dysfunction. 8. Muscle atrophy. Loss of nerve connection can cause muscles to shrink in size as well as weaken. This especially happens in the feet, lower legs, and hands with peripheral neuropathy. Sometimes there are deformities of the feet and hands because of muscle loss. 10. Imbalance and clumsiness. Nerves also carry sensations that your brain uses to keep track of the location of your hands and feet. You are not consciously aware of these sensations, but they are critical for balance and coordination. Without these sensations, you can experience a loss of balance, especially in the dark, and clumsiness with your hands. Other symptoms. Autonomic changes from peripheral neuropathy can also cause skin color changes, swelling, changes in the pupils of the eyes, and blurry vision. If you answered yes to one or all of these, you may be experiencing nerve pain. Recognizing this is the first step to getting the help you need. So, how can you treat nerve pain? You can adjust your eating habits to address underlying causes of neuropathy like diabetes, celiac disease, and nutrient deficiencies like not having enough vitamin B12. Also, exercise can help to prevent or slow the progression of diabetic neuropathy and strengthen muscles wasted by motor neuropathies. For starters, a healthy diet and active lifestyle can contribute greatly to easing everyday pain. Trust me when I say this will be a game changer in pain relief. Imagine getting up each morning, standing on your own, and walking outside without any pain. That's what I like to call a success.